The BiWaze airway clearance system from ABM is part of a portfolio of respiratory care products. It's designed for use by healthcare providers, caregivers, or patients to simulate a cough to clear mucus from people's lungs who are unable to clear them with a natural cough. It is a non-invasive therapy that is a safe alternative to invasive suctioning and other airway clearance therapies. The BiWaze airway clearance system combines hygiene and personalization into a unique therapy experience. It helps people clear their airways by mimicking a natural cough, as well as mobilizing mucus with its oscillations and lung expansion therapy options. Coughing is an important part of airway clearance, particularly for people with lung disease, weakness of respiratory muscles, or people with neuromuscular diseases and conditions. The use of assisted cough therapy to enhance airway clearance is essential to avoid retained mucus that can cause infection, inflammation, and respiratory failure. The BiWaze system was inspired by people who need airway clearance treatments tailored to their changing respiratory needs. BiWaze provides a unique experience with multiple therapy options like high-frequency oscillations to break up mucus and aid in moving the mucus out of the lungs. The oscillations can be turned on during the inhalation and exhalation phases of each cough cycle, as well as during the positive airway pressure of the pause phase. An optional dual air path circuit separates the inhalation and exhalation airflow. This exclusive design keeps the mucus coughed into the tubing from being re-inhaled during the inhalation phase. Each air path is driven by a dedicated blower, ensuring the air paths are separated within the device. You can use a standard single-channel patient circuit if you prefer, but inhalation and exhalation airflow will not be separated in the tube. Another therapy option is to synchronize the person's natural breathing pattern with a feature called Respiratory trigger. This feature has an advanced algorithm to detect a person's natural inhale and trigger the BiWaze inhalation, so the therapy is more comfortable. The system can store up to 10 therapy profiles of pre-programmed therapy protocols. Profiles provide choices for therapy, so a person can select a therapy based on how they're feeling. In addition, BiWaze has the capability for each cycle to be programmed differently, providing a therapy tailored to each person. The BiWaze system is redefining airway clearance with a dual air path design. The system combines hygiene and personalization into a tailored therapy experience. BiWaze helps people clear their airways by mimicking a natural cough, as well as mobilizing mucus with its oscillations and lung expansion therapy options. For more information about the BiWaze airway clearance system, visit our website at www.abmrespiratorycare.com.